All right, today we're here at the vet with Bruno. He's going to get some acupuncture done. Your name is Dr.
Beth Frank.
Thank you, Dr. Frank. And your assistant?
Brandy.
Thank you, Brandy. And of course, the star of the show, Bruno.
Oh, did you hear my name?
He says, I know what this is
Thank
about.
you for the kisses. Damn,
Bruno does have some tension.
He is, only can have duck, Dr. Frank.
Okay.
Yes.
So he is treat restricted.
And we forgot his treats today.
Has he ever had acupuncture before?
Not acupuncture. We've been doing chiropractic.
Okay. How does he do as after his chiropractic treatments?
It depends on how the adjustment goes. Sometimes he's a little sore,
Okay.
especially, when he has the bigger yelps with the back area where she's done.
Okay. And have you ever had acupuncture before?
I have not had acupuncture, but I've had dry needling,
Okay.
which is very similar. It's better than cupping.
Yes. Cupping can be pretty painful. I think.
And being on blood thinners, it can be very
That can-
bruisable.
Yeah.
All right, so we now have a needle.
We have a
and-
needle. So we're going to put in some calming points first, just to
Okay.
help with his anxiety, just to get him used to what I'm doing, just to let him accept this.
Okay.
There's a pretty profound endorphin release with this, so not only will that help with pain, so natural opioid release, but it also helps with him just accepting that this is not the worst thing that could possibly happen to him. I like to go slow. I feel like I get further with their treatments. We get more advancement if we don't push them too hard.
Okay.
This should not be a stressful thing for him. This should not be, oh my God, I went to the vet and I got poked and prodded and it was the worst thing that ever happened. He should really actually enjoy this. He should come
Yes.
down, flop down on the bed and be like, hit me with more needles. So
Now, to be fair, Bruno will just sit there and whine because he knows he can get away with stuff.
he says, I just want attention.
Unless it's dad.
Okay, so that might just be dad. But let's just see if we can get him so that he thinks it's not the worst thing that happened to me today. Hi.
His grandma will be interested in this because she was wondering how being stuck with needles would be.
I'm gonna take a picture of this too.
I know.
Oh, Bubba, you're fine.
You're a good boy.
So he'll sit there and whine for like hours with mom
Okay.
at night, and with dad he won't.
Okay. So he's learned who to manipulate. Okay.
And he thinks he can get the same sympathy from outside sources. Because normally they do the exact same thing mom does.
Okay. He's training the whole population to cater to him.
He's been my training assistant for almost 15 years.
Very nice.
He's helped many dogs and helped people learn how to be calm.
That's actually really interesting.
He
And
helped,
it's always good to have a great training partner. Hello.
he's been a wonderful assistant. I was happy to be able to get him back into rotation.
You're doing very well, sir.
Good boy, handsome man.
I'm glad to know that you don't go for that one nerve like they do with dry needling. That you feel that
What's
nice.
the difference exactly?
So with dry needling, so technically right now I'm still doing dry needling. I'm not adding any e-stim, so electric stimulation yet. I'm also not doing any injection of acupuncture, which can be done with B12 or Adapon or medications.
Okay.
But when we typically say with dry needling, we're also including some trigger point work. And with that, you're finding either a myofascial plane or an exact point that has, and he does have some trigger points. But then you're actually going to sit there and you manipulate through until you get that trigger point to break loose. Fortunately, that can be extremely painful because if you can imagine when you have a trigger point, the greatest one that I explain is most people have forearm trigger points, and if you feel right across if you use your hands a lot, you'll have a trigger point right in the forearm. You can feel it, and you'll feel it down to your fingertips. What you would do is you actually manipulate through that trigger point, just localizing that until you get that to break loose. You can imagine that can be very sensitive and very reactive to these guys.
But once it does release, you have a very relaxed.
Euphoric feeling.
Oh, wow.
Yeah.
It feels fantastic. But another way to think about it is when you have that deep tissue massage, if you had where they sit there and work and work and work, applying pressure for 2 to 3 minutes over a localized trigger point will actually get the same effect. But you can imagine, you know how you feel bruised almost after those?
Yes.
Feels great. Then you have that little.
Okay.
So.
Especially if your skin likes to stick on those needles.
So these needles are actually silicone coated, so
Okay.
they are sterile. I just open them so it's a little bit less stress for them to hear the packaging unwrap. So they're sterile, individually used, and then we toss them after every time.
Nope. I want to put my finger on the camera.
You're a good boy.
You're doing so well,
Okay,
honey.
so we're gonna do some hip work now. I know, little dude. That's a good boy.
Settle.
It's okay.
Settle.
Okay.
That must be a spot.
Yeah, it's a little tender.
So when you do place these needles, are you able to feel where
Yeah.
some discomfort is?
Yes.
Okay.
Right, so I'm gonna a little bit.
Yeah, she is, from what I understand with the dry needling, she's feeling right there. She's feeling the nerve and how the muscle's reacting to it.
Okay.
And so you could actually feel the muscle almost spasm underneath my fingertips.
Thank you.
So all of this is based off palpation. So this is not something that you honestly even need lights on for, because it's all, you notice that I'm counting either rib spaces or vertebral bodies. Right here, I'm actually using all of my landmarks to calculate exactly where I need to be when I'm palpating. And you can feel the muscle response.
Okay. Will it have like some type of fasciculation whenever you
You
hit
can
that
actually
spot?
feel that, yeah.
Okay.
Hi, baby.
You're doing so well.
Okay, sir. I know. We're gonna start on this side, and then we're gonna roll on the other side. No, we won't make you roll over yet. Okay, I know you've been compensating a lot on this leg.
Yeah. It's got a
Yeah.
fairly large growth on this other side.
He says I'm gonna pull myself up so I avoid using my back legs, and then I'm gonna.
Oh, you're a good
While we're on this one, I know you're a good boy.
You're a handsome man. I know.
There you go.
Your whines make me so sad.
He's got you well trained?
Oh, he does.
He says I'm gonna manipulate the system.
I'm just like, I feel like I just gotta give you all the cookies and loves. I know.
And you're just going to give him more as he does it.
No, it's okay, Papa.
Oh.
I'm a sucker. I am.
He says I know.
I'm a sucker.
Great.
I am.
We, so, you know,
He's a good boy.
I told you how dog world is. I can play in their world.
Okay.
We have a game that we do that is specific with him, and Charlie's trying to get involved. He doesn't fully get the game, but sometimes it ends with me getting a face washing. Luckily, all that just washes off, right?
Yeah, does that feel better? I know.
But even when, you know, wrestling, especially with Cinnamon, you know, I can play with the biting and things like that with my hands, and she loved every minute of it.
Yeah.
She'd come back for more. She sounded like she's trying to kill me when
Yeah.
she's doing it, but she loved it.
Good boy.
Oh, good, bud.
Really well, Bruno. That's my boy.
And sometimes he does it just because he doesn't want to be doing this.
He's like, you're making me something I don't want
Whatever
to. So
this
I'm fine.
is. Or he wants a snack. We we learned a long time ago that this boy likes to undo knots. So we started getting small towels and putting his night snack inside of it and putting a knot in it. So he's got to work for it.
He says I'm smart. There you go, buddy. I know. You're doing really well. You are. You're doing very, very well.
He can be a kisser.
He's giving me many kisses already.
You giving kisses? Yeah.
How has he been doing since Cinnamon? Has he been really emotional or anything like that?
So we flip Bruno over. We're doing the other side.
I'm gonna get you a cat Dr. Frank video.
As you see, it doesn't necessarily hurt. Bruno just whines to whine sometimes.
So he feels more of the pressure from the guide tube, so the little plastic tube, and then just a tiny little pinch. These are so much smaller than anything that would ever be used to vaccinate. But I can feel the little muscle fasciculation underneath my finger that's a little bit lower than the needle itself. So I'm working around this mass that he has, but he has all these muscle spasms around here that we want to deal with, getting him so he's a lot more comfortable through the shoulder itself.
Okay.
He's a good brother.
I know, buddy.
Yeah, I'm sure Bruno, being his first time with the palpitations, isn't as comfortable with that as part of his, hey, I'd rather be doing something else whine that he's doing.
He says, I'd rather not
I'd rather
be here.
not be doing this. Now, if you could just give me a whole bunch of T-E-R-T-R-E-A-T-X, that'd be great. But you have an allergy, buddy. Sorry.
Hi, buddy. You're a good boy.
That he is. All this is in an effort to help Bruno move easier. Maybe it helps him with staying in training a little bit longer. His brother Charlie might be the primary, though. Throw him into the fire. But you know, Bruno is going to be 15 on the 20th of this month.
Birthday.
Oh,
That's next week, little
we're
man.
gonna have a birthday party.
He hasn't had one fully like that since being with us, but you know, we get a walk. Oh wait, he does that every day.
You're gonna have him a birthday party and the cake.
What kind of cake you want, Bruno?
Where are you going? Did we say cake? I'm sorry. I apologize.
He's like, I heard
I
snacks.
heard snacks. I'm sorry. I took my dog to birthday party at the dog park. And they all had matching hats.
But overall, he's tolerating his treatment really well for a first time, so it's really good.
So-
some of them really don't like their needles, but he's doing very well.
So we let them sit in there to continue to activate.
Yeah,
that
and if you
particular
notice,
nerve.
I've been manipulating the needles. So you can see when I place them, they're actually perpendicular to the skin. The collagen fibers within the muscle bellies actually can manipulate them. You'll see that some of them are laying flat, and that's what is pretty normal when they're really reactive points. Now, all of these points are actually based off, they're either in channels and meridians, so based off all of the Chinese medicine that has been crossed over to, all of the animals. So this is where there are bundles of nerves or where muscle bellies intersect. So he does have some trigger point work that I'm doing down, especially in this, which is more of muscle work itself. But then he has some that's directly, affecting the joints. Because we want to make sure that we're trying to treat all of the pain level and helping with those nerves and everything like that. So kind of a combination of everything going on for the little man.
Wonderful.
Guess you're not that little though.
Okay.
So his muscle tension has definitely released in his forelimb. So right now, and it was hard, I should have had him palpate before, but he no longer has that muscle tightness, especially in this tricep. So huge improvement in what's going on in the poor little guy. So, this is one of those things, acupuncture is cumulative, so you should see a benefit, and then it'll taper off. The next time you should see a benefit for a little bit longer.
Okay.
And then we find that magic sweet spot of where he responds the best. This is something that is maintenance. It's not something that's going to be a cure-all. It's just like you're doing his chiropractic work. It's not one treatment. And it is also very individual. So I can't say that, his magic dose is going to be whatever, one pill a day. We have to figure out exactly what Bruno needs. So he gets to determine this one. He's in charge.
Hey, you're in charge. Good luck.
Yeah, you are.
Thank you, doctor.
You're welcome.